everyone, we're going to draw extraocular muscles. We're going to do their positions and testing and actions and all that good stuff. So there are 4 recti muscles: superior rectus, inferior rectus, medial rectus, and lateral rectus, and 2 obliques, a superior and inferior oblique muscle. And I also like to mention there's 1 palpebral muscle to the eyelid, levator palpebrae superioris. So let's draw a right eye, and we need a little pupil and iris. And here are the positions of recti: superior rectus, medial rectus, lateral rectus, and inferior rectus. And they all originate from the common tendinous ring. And we'll put their muscle bellies on here so we can see kind of how they run. The common tendinous ring is towards the apex, kind of medial in the posterior orbit. Now, for the obliques, we need a trochlea. So this is going to be for our superior oblique that comes around, changes directions, and inserts on the posterior lateral part of the globe. And inferior oblique comes from the maxilla to insert very near superior oblique. So great, we've got our muscle bellies. Let's draw another eye. And again, we're going to keep a right eye as we're looking at our patient with our pupil and our iris. And we need some actions. So we're going to have up and medial rotation and elevation and lateral rotation. We're going to put labels on these in just a second. Adduction and abduction. So we have elevation to look up, depression to look down. We have adduction, which would move it towards the nose, and abduction, which would be away from the nose. And then we have medial rotation, which is a point on the eye that goes towards the nose, and that's going to happen from 2 different areas, and lateral rotation. And we also will have 2 areas for that. And again, that's a point that's kind of right here on the superior part of the globe, moving in and out. Okay, on our adductor side, we need superior rectus, inferior rectus, and of course, medial rectus. Our abductor is a lateral rectus, as are the obliques, so superior oblique and inferior oblique. Now, these are the anatomical actions of these muscles, so up and out, down and in, up and in, etc. Let's put their innervations. We have the superior division of ocular motor for superior rectus, inferior division of ocular motor for medial rectus and inferior rectus, 4 for superior oblique, 6 for lateral rectus, and of course the inferior division of 3 for inferior oblique. Now let's put their testing positions on here. Now we need to swap inferior rectus and superior oblique in terms of where you're going to draw the eye to test. And we're going to swap inferior oblique and superior rectus. Again, these are the testing. Medial rectus, lateral rectus stay the same.